So, as far as acupuncture versus recuperative movement and which would come first, uh, it can be a tricky question. Sometimes it's one and sometimes it's the other, but often acupuncture can be beneficial first because, if there's injury in the area, if there's local inflammation, damaged tissue, then trying to do the recuperative movement, you're going to be moving through that injury. And although over time that can open up circulation and help rehab the injury, if you do the acupuncture first, it will often have a beneficial effect of reducing that inflammation, getting some blood flow back into the area and opening up that movement. So that then when you do the recuperative movement, whether that's personal training, physical therapy, assisted massage, whatever it is that you're doing, you're not necessarily trying to move an area that's already constricted and injured.
So would you tend to have someone that's like a 6-week injury would be too much inflammation? A 6-month injury would be great for acupuncture?
It really, there's not a point where there's too much inflammation. Really even the day, an hour after the injury, acupuncture can be of benefit. Now, in a case like that, I'm not necessarily going to treat immediately in the area because the needles locally in that case can definitely aggravate the inflammation. It can increase the injury. But what we're going to do is we're going to treat distal from the injury in order to draw that inflammation out of the area, in order to increase blood flow, lymph action, and things like that to reduce that local inflammation and get that healthy blood flow back in. Because healing really in the end is all about blood flow. We want the blood flow in there, but it needs to be the healthy recuperative blood flow because when that inflammation is there, it really stops up that blood flow and you get a lot of deoxygenated blood trapped in the tissue, and that doesn't really assist the healing. We need to get that blood in and out, that blood exchange going, and so reducing that inflammation anywhere from an hour after an injury to 6 months after an injury is going to benefit that healing process.
What do you think is more beneficial for sciatic pain? The physical therapy movements themselves and strengthening and loosening, or first off, the acupuncture or the physical therapy first?
Again, I think that it's a little case by case, but I think the acupuncture is probably beneficial first because, again, sciatic is an inflammatory disorder. So what you're doing there with the moving and strengthening within the physical therapy is you're moving through an area where there's already inflammation. The reason sciatica hurts worse when you walk is because you're moving an area that's inflamed. It doesn't want to move, and so it's becoming aggravated and increasing that inflammation. But if you can reduce that inflammation, what it does is it opens up the opportunity to then come in with the recuperative movement and the physical therapy without that inflammation in there, and then start that movement and strengthening process so that you're working with healthier tissue to make sure that it stays healthy. Now, that is a crucial part because if you just do the acupuncture, oftentimes what's going to happen is the sciatica is going to come back because you haven't addressed the structural problems that led to it in the first place. That's where you need the stretching and the strengthening and those things because acupuncture, it's not going to stretch you or make you stronger. It's just going to reduce the inflammation and get that blood flow back in. It's going to get the body moving, but it's not really going to fix that root problem. So you need to open it up so you can move and then follow through and do the movement and do the practice both with your physical therapist and at home. That way you get strong so that the problem doesn't just keep coming back and back and back and back.
So, it's just, physical therapy itself versus, physical movements instead of just physical therapy. So the idea of the soft and versus the hard, like
right.
Stonegate Wellness is going to be the acupuncture, the inflammation response, bringing it down, while Austin Holistic Fitness would be the actual movements, strengthening, and then working through the range of motion. And if that inflammation comes back from doing that, reduce it, increase the range of motion, reduce it, increase range of motion, and now everyday movements are just going to be easy, and the chances of you falling back into that system are harder.
Absolutely. And it's exactly like you put it. It's that two-prong attack. We want to get the body where it can move, and then we want you to do the movement. We want to soften and reduce, and then we want to make you strong.
Perfect. Thank you.
Yeah, no problem.